everyone, and welcome back to Anecdotal Evidence. This week we have a very special episode for you that I'm excited to share. This is my conversation with Dr. Angela Hind. And Dr. Hind is somebody who I became familiar with her work from an article about her in Asheville's local Mountain Express. And the article shared how she does consulting work that educates the government and the public about the dangers of toxins such as fluoride, as well as the dangers of genetically modified organisms and how they've fully infiltrated our food supply. And these subject matters are ones which are interesting because there's lots of mystery and uncertainty regarding these subjects, and our country and our world has charged forward despite this uncertainty in a way that seems careless and reckless, and certainly incites fear and concern when we think about all the complexities regarding these issues. And so I wanted to learn more about it personally, and also wanted to share it with you, the audience of the podcast. I really appreciated my conversation with Dr. Hind. She shared how she has gone through a personal experience where she became ill, and it changed her practice as a physician, changed her career. And I could relate to that experience, having personally faced many of the challenges of our healthcare system and how it impacts our ability as physicians to help people towards a true healing path. And that is a huge difficulty and a huge challenge. And so are the challenges of figuring out how to appropriately deal with issues like fluoride and genetically modified organisms. And I really appreciate what Dr. Hind shared in our conversation, in which she describes her experience with illness and how it changed her viewpoint and changed her practice and helped her discover more about healing and what that really means and what that is. So this is a special episode that I hope you enjoy. It marks one of the last episodes in our anthology of anecdotal evidence that I've been collecting over the past couple years. And so I hope you enjoy my conversation with Dr. Angela Hind.
Well, I grew up in North Carolina. I grew up in the South, which is an interesting culture to grow up in, particularly as a woman, and particularly in the 1960s, and particularly as a woman wanting to go to medical school. And then I went to medical school in North Carolina. I did all my training. I went to Duke University for undergraduate, and then I went to East Carolina Medical School. East Carolina is a school that's very focused on patient advocacy and primary care, and I was very interested in that. I had a wonderful experience at that school with a lot of mentors who really embodied this idea that the patient, that we are working for the patient, that we are patient advocates as physicians. Mm-hmm. So I left medical school wanting to do primary care, internal medicine, and I did my residency at Chapel Hill, University of North Carolina at Chapel Hill. I did an internal medicine residency, which was quite grueling, but quite rewarding as well. It was an interesting time to do residency. It was in the late 80s, early 90s, and it was when the HIV epidemic had just begun.
Yeah.
And at that time, the rural areas were very afraid of HIV. Yeah. Everyone was kind of afraid of HIV because they didn't quite understand how it was transmitted. Yeah. And so we were a teaching hospital, and so every HIV case in the state was referred to our hospital. Oh. And at that time, it was just a tragic time for HIV patients because every one of them died. There was a 100% mortality rate associated with HIV. Oh. And so when someone came we had the only facility to test for HIV. So patients were referred in. They were presumed to have HIV based on their clinical presentation, but then they would come to our hospital and be tested. And so the residents were kind of tasked with telling patients that they were HIV positive. And that was like giving someone a death sentence. And these were all young people. People who got HIV are young because it's a sexually transmitted disease, or by needles or blood transfusions. But primarily, most people got it through sexual contact. And so these were young people who had the rest of their life in front of them. And they were given a death sentence. And not only were they given a death sentence, but, HIV, it used to be that the way you died from HIV was over the 18-month period from diagnosis to death. You had one opportunistic infection after another. Yeah. So you were in and out of the hospital with really gruesome diseases that were so painful and so taxing on your body and emotional self. Diseases that immunocompetent or people with normal immune systems do not get. Yeah. So it was just an incredibly moving 3 years in my life. It was like a war zone, really. Yeah. And it was very traumatic to watch so much death and sickness in a short period of time, particularly when we had so little to offer all of these young people. But it also was incredibly inspiring because it showed me kind of the true strength of the human character during illness. And maybe more importantly, it showed me the value of illness. If there's any value of illness, it is that it is definitely a chance to transform to a higher place in one's life. And I watched people who were given a death sentence, and they, the initial response is, of course, depression and horrible sadness and grief. And how do you ever come to terms with the fact that you will be dead in 18 months? And what do you do during that 18 months? Because you're going to be sick for so much of it, and you're trying to come to terms with dying at such a young age. But I watched so many of those patients kind of transcend that horrible reality to a place of, to a better place, to a place of love, connection with other people, to a place of real healing within themselves. And so I was so inspired by the people who were sick, and following them through their illness to death was just a very transformative time in my life, and very inspiring. Yeah. The human spirit is incredible. It's just incredible what we can do when we're faced with challenge, in particular challenge with disease or illnesses.
Thinking about your interest in primary care, I think about, wellness and an interest in health and following folks longitudinally and things like that. And then, going into internal medicine during the AIDS crisis. That must have been traumatic. Or was that what you were after? Were you looking to be on the front lines?
No, I don't think any of us anticipated that that path. That we did not know that was going to happen, certainly. Okay. Not at all. But, when you get there and you're a doctor and you really do care about your patients and health and mitigating suffering, then you just dive in and you do, what you have to do, particularly if you're in training, because, you're the front line and you want to learn and be the best you can be as a physician. So it was a beautiful experience, overall, but certainly day to day, it was incredibly traumatic. And I actually had to do some healing from that experience myself, watching so many people be so sick and die so young over a very short period of time. It was literally, 10, 20, 30 people every day dying, it was like a war zone. But again, it really, made me understand how strong the human spirit is, and, that when all of us are faced with a challenge, particularly a health challenge, we can use that time as a catapult to really trying to get at what's important in our life. And kind of pare our life down to what is meaningful and what is our true purpose, and what are our priorities, and also to heal, to do some inner healing, even if you only have a short time left. I saw incredible stories of healing, because a lot of AIDS patients, they had tumultuous lives because they had been drug abusers, and had a lot of healing to do from that. They also, a lot of them were actually, because a lot of the disease was within the gay population, the male gay population, and it was during a time where that lifestyle was really shunned. Our country was struggling with that a lot. Right. So these people were injured by society. Our society was incredibly cruel. But, the healing that occurred as a result of being faced with illness and death, the stories were really profound and they touched me deeply. And I think that was the first time really in my life that I understood what true healing was. I didn't quite yet understand that the medical system runs completely counter to that true healing. But that was to come 20 years later, with a lot more insight and experience.
You fast forwarded to the idea that, seeing how the healthcare system does not address these problems in a satisfactory way, perhaps, was part of the message you were getting.
Yes.
How did this come about?
Well, after residency, I got in the medical rut a bit. I worked as an internist in Alaska for 7 or 8 years. I had a private practice and actually flew around the bush of Alaska as well. The bush is the outback of Alaska, and treated patients there, and then had my own private practice in Juneau, the capital of Alaska, and worked in the hospital there as well. So that was a beautiful experience. Alaska is beautiful, and Alaska has cruise ships. About 10 to 15,000 people a day get off the cruise ships in Juneau, Alaska. So we took care of those people, which really was magical in that you just get exposed to so many people from all over the world at a time when they're ill, which is really a time when we're very vulnerable. And right. One of the beauties of being a physician or a healthcare provider of any type is that, we're really given this gift of interacting with people at their most vulnerable point or at a vulnerable point in their life. And so whenever, that really is a gift for the physician, because that really means you can connect on a very deep level with another person, and then, help them as well to understand their illness and hopefully heal from it. So during my time in Alaska, I understood that being a physician was being afforded a huge gift. And then I moved to Asheville. And I became a hospitalist. I didn't do outpatient work anymore, and so I didn't have that one-on-one connection with patients, patients who I could get to know over either a few days or a couple of weeks or even years. As a hospitalist, you just meet people, take care of them, and then they go on to the next doctor, really sometimes the next day. Certainly, you don't interact with them more than a few days at a time.
Yeah.
That was a very difficult job for me because it was very busy and high stress, but more importantly, I didn't get to connect with people. And that connection as a physician is really what fed me in my job. And I think I didn't understand that, or I didn't understand there were places in the medical field that you don't get that connection as an internist. And so that was a little bit of a dark period in my life, frankly, in my professional life. I was trying to understand the medical system and how we could kind of be severing this patient-physician relationship, because I had always seen it as so valuable. And the patient-physician relationship, as you know, is just incredibly valuable in terms of true healing, because it is through human connection that we heal, and also through insight about ourselves and our disease. And so if you sever that relationship, then what does the medical system have to offer people in terms of healing? And obviously the medical system does have things to offer in terms of if you have a traumatic accident. Certainly we're great at that. If you're in a car wreck, there's no other place you want to be than the emergency room and the ICU and, all the wonderful healthcare nurses and physicians who treat trauma-related illnesses. If you have an acute illness, pneumonia, appendicitis, meningitis, again, there's no place you want to be other than, the hospital. So the medical system does some things incredibly well. And then it does other things not so well. And the thing that it doesn't do so well is treat chronic illnesses. And as an internal medicine doctor, as you know, that's primarily what we treat. We do some acute illness, but really we're treating chronic illnesses. And those are the illnesses such as cancer, diabetes, autoimmune disease, heart disease, autism spectrum disorders. Those are all chronic diseases, and that's what internists primarily treat. And so, interestingly, after doing that for about 6 years, I got very ill. Mm-hmm. And I'd never been ill in my life, and had been given incredibly good health. And really, maybe that was a curse in of itself, because I didn't really think about my health much. I just, the medical system kind of says you can eat whatever you want, you can sleep as much as you want, you can kind of do whatever, because whatever happens, we'll have a drug to help you, or there's a way out. And so I hadn't thought about my health very much, but then I got very ill, and it wasn't really clear what I had at first. And in the end, it turned out to be autoimmune thyroid disease. But it was kind of like one thing led to another with this illness. And in the end, it was clear that the medical system didn't understand didn't understand the illness. It turned out to be an autoimmune thyroid disease. It turned out to be gluten intolerance of all things. And that was 8 years ago, when really the medical system knew nothing about gluten intolerance. We didn't even talk about it. And even celiac disease, it was so rare that as physicians, we didn't really acknowledge that or think about it much. Mm-hmm. So that's what I had. Yeah. But I didn't know it at the time. So I had autoimmune thyroid disease and celiac disease. And so it was just a very dark period in my personal life then, because I had been so beholden to the medical system. I had gotten sick. I had access to many doctors and subspecialists who all cared very much and were trying to help me. But there were no answers there. And it was incredibly frustrating and really depressing, because I felt I got sicker and sicker, and didn't know where to turn. Mm-hmm. And kind of at the depth of my illness, where I almost to the point of despair, I was blessed with a gift of the inner truth that I've got to figure this out on my own. Mm-hmm. And that I have to stop looking to the medical system for the answer, because I had done that for about 1.5 years. Mm-hmm. And it just kind of hit me over the head one day that I literally might die if I don't make a radical change here. Clearly the medical system is not going to heal me or help me. And I have to come to terms with that, because I had always seen it as just this incredibly powerful and helpful institution and entity. And so I had to turn my back on that. And in the end, that took me to functional medicine and to a lot of incredible teachers and people in the country and really in the world right now who are thinking about healing in very different ways, and thinking about healing in ways that resonated with me, and basically thinking about healing in terms of, what we eat, what we are exposed to in our environment in terms of toxins, and what our consciousness brings to us in terms of stress or lifestyle. Those 3 things are really what determine whether we heal or not. They determine whether we get sick, and they determine if we're going to heal.
Okay.
So,
taking it back though, here you were, well into your medical career. You've taken care of people for several years, many years at this point. And then the tables are turned and you find yourself a patient, dealing with illness in your own body, in yourself, in your own being. And you realize that the avenues that you had been providing help weren't giving you the answers that you needed or the solutions that you were looking for, the healing. What you mentioned that it was scary. Tell me a little more, if you will, about how it, not just how it felt, but also where you turned. Where did you go? How were you able to heal?
Well, those are all good questions with no simple answers.
Yeah.
But I think when I started to get sick, I was still working. But it was becoming very hard to work because I just didn't have the energy, the physical energy to do this grueling job. And then, and so I was kind of getting sicker and sicker and realizing something really wasn't right. And one morning I was signing out to the next physician, and NPR came on, and I was sitting in a parking lot. I'd pulled over to sign out, to speak on the phone and sign out to the physician who was following me. And NPR came on right after I signed out. And it was a story about hormone replacement therapy. Mm-hmm. And it was the first time that this story had made national news. And it was a story about how for 20 years we had been giving hormone replacement therapy to women under false pretenses, that really the drug companies had forged the science. The science wasn't there. They had lied about the science.
So that's a sickening feeling you have
it was
listening
sick.
to that NPR.
It was. It was
segment,
a down
yeah.
point in my career. It's probably and I drove away and I thought, I'm quitting my job. I'm going to figure out what is wrong with my body.
Yeah.
And I did. I quit 2 days later. I put in my notice. And,
Wow.
and so that was the kind of, radical transformation or radical decision. It wasn't a transformation yet by any means, but radical decision I had to make in order to start my healing journey. And that's what I mean when I had to just renounce the medical system before I could move forward to understanding true healing. And then come back to the medical system later, but years later.
Uh-huh. So you took some time off to
I did.
to do some personal
About
healing?
5 years. Mm-hmm.
Yeah.
Maybe 4 years. Yeah, 4 to 5.
Uh-huh.
And I had just adopted, or my husband and I had just adopted our third. We have 2 biological children, and we had adopted a third child. And so I had a new baby and was ill, and so I really needed to tend to come back to myself and my family and figure things out with my career.
Yeah.
So yeah.
So a lot of change going on at this time. Waking up more to the medical system and how things can just be pushed in the wrong direction from a variety of forces.
Yes.
The drug companies,
That's a good way to put it.
Insurance companies, the algorithm nature of medicine.
Yes,
the breakdown
absolutely.
in relationships. And, I had such a similar experience when I was a few years into working in the hospital-based system, where I realized that, a lot of what we were doing was not helping these chronic mental and emotional disturbances, but actually making them worse, and, that things are going the wrong direction. And it's quite a terrible feeling to know that I'd been part of the problem.
Yes.
And I can definitely relate to some of these sensations. And so at this stage in your journey, what did you start opening up to? What came to you then?
I did become more ill, but what came to me out of that was the understanding that true healing does not come from the medical system and never will come from the medical system. It comes from within ourselves and from our community.
Yeah.
And the medical system not only doesn't provide us with healing, and this again is just for chronic illnesses. This is very different than acute illnesses.
Yes.
But the medical system not only does not provide us healing from chronic illnesses, it actually is a complete diversion from healing, because it tells us that this is where you go to get your healing and to get your medical treatment. But then when we get there, we're merely given Band-Aids for symptoms, for the symptoms of the chronic disease. We are never told how to reverse the disease, cure the disease, by looking at the underlying cause of those diseases. And, the science is there. We know that what drives this chronic illness epidemic in our society is bad food, environmental toxins, and psychological stress. The science is there. We know that. But our public policy and our medical system lags behind that science.
Yeah.
And I truly believe if we presented patients with the reality of, if you take this medication-based path with your diabetes or with your autoimmune disease or with your heart disease, we know where you will end up. More medications, more procedures, more heart disease, more diabetes, worsening disease.
Right.
But we know if you take this other path of radical diet transformation, environmental toxin avoidance, and psychological stress reduction, you will end up in a completely different place. And that place is true transformation, true healing. And that is the path we all need to be heading down. All of us who have or have had chronic illness. That path prevents chronic disease and it cures chronic disease. And it brings us to a better place in terms of just being human. It brings us to a more human place and a more humane society. So the medical system, for all its good, has this incredibly destructive part that diverts us from true healing and makes us believe that medications and ignoring underlying causes of our disease is a viable option. And it's not, because it leads us to more illness. The medical system keeps us sick instead of making us well.
Yeah. And that's very unfortunate. And that's still what we're dealing with, even though there's been people who've been talking about this for a long time, and it's a controversial thing to face. It's a wake-up call that we need to respond to as a society. And I'm glad that you're sounding the alarm again. So you are having a total changeover in mentality, it sounds like, at this time.
I really did.
Yeah.
I think it's always in there. It's in there for all of us.
Yeah.
We know what it means to be human.
Yeah.
In the depth of our soul, we know what we need to value in order to be the best we can be, to be the most human person we could be. But we're really in a fight in our society right now to keep our humanity. At every turn, what it means to be human and what we need to be human is being attacked. Whether that's human connection at its very deep level, whether that's good, nourishing food, whether that's a clean environment, clean air, clean water. All those things are a must to be human.
Yeah.
And when our society chooses to not value those things or not make them a priority, then we become sick. Yeah. And so every time we take a step towards those things, it's a step towards freedom. And that's really what I've learned. Do I always practice it? Of course not. It's just such a path and it's such a challenge every day. Life is a challenge. But every time we accept that challenge and fight for what it means to be human, fight for those values, we take another step towards freedom and peace in our life and in society. And I like to say health in ourselves, health in the world, because if we start with ourselves, that's really the only place we can start.
Yeah, it is a struggle, and it's not supposed to be easy, I suppose.
Exactly. Life isn't supposed to be easy.
Yeah.
We're told by corporate America and the corporate money agenda that life is easy and fun and you can have all these things and have fun all the time. And if you don't, you're kind of weak or you're kind of, too serious. But really, life always has been a challenge, and it always will be. It's a struggle in a good way. And every time we meet that struggle, we get better and stronger and more human at its highest level.
Yeah. Well, these are inspiring it's inspiring to hear this description of our humanity and, how you discovered more of that and got reconnected with your own sense of who you are as a human being recaptured that while the particulars of the physician role as it was defined in that situation were not fitting for you anymore. So you were able to shed that role and then kind of reconnect with your true humanity. And I'd like to continue this with, you're still a trained physician and you have this, medical education and abilities, and, you're still practicing. So you're using your training and your ability to still practice the art of medicine now, beyond this personal healing journey. How did that come about?
Well, I knew that I couldn't go back into the traditional medical world. I had moved on from that because I was an internal medicine doctor, if I'd been a trauma surgeon or something like that. But, as an internist, if I went back into the traditional medical world, I would have to do the medication route and kind of the keeping people sick route.
How do you see yourself creating the physician role, for yourself in a way that feels authentic and that you're doing the work you need to do?
Well, about 2 years ago, I opened a consulting business. And, when I opened it, I didn't have any clients. I just had this need or desire to every day, the rest of my life, work as a physician to help people and society move towards this path of true healing. Mm-hmm. And by that, I mean the path of valuing food, eating food that supports our health, rejecting food that does not, rejecting food policies that do not support health, rejecting environmental toxins, and understanding the value of working with our consciousness and having less stressful, more connected with other people lives. Mm-hmm. So I made that vow. I said, every day till I die, I'm going to do something to perpetuate that path. So I opened this business, and I was just very lucky. The first thing that happened is a friend of mine came to me and said, we have a big anti-water fluoridation group that she was part of. And we need some science or medical experts to help us with that aspect of the fluoride issue. And so I started looking into water fluoridation because I'm interested in toxins. And I had already gone back and done some training in functional medicine and molecular toxicology. So that was where I was at, training-wise, and also just mentally, this path of clean food and no environmental toxins. And so I said, sure, I'll look into it. So I looked into water fluoridation, and it was just another step along this long path of awakening to the realities of the problems with our health. Mm-hmm. Why we are facing this epidemic of chronic illness. Yeah. And just to give you a few statistics, I know you know these statistics, but just to give listeners.
Yeah, maybe not.
So right now we have 1 in 6 children with neurodevelopmental brain disease. And those are diseases that include ADHD, autism spectrum disorder, behavioral disabilities. That's 1 in 6 children. We have 1 in 8 women will develop thyroid disease. 1 in 8 women have breast cancer. We have one half or 1 in 2 of all men will develop cancer. 1 in 3 of all women will develop cancer. About 10% of us have diabetes, and about 30% have prediabetes. These are incredible statistics. And when I was in medical school 25 years ago, this is what we were taught. Diabetes type 2 did not happen in people under 65. Yeah. Now we see it happening in children, literally.
Yeah, right.
Literally. Mm-hmm. But that was the dogma. Only 25 years ago, there was no diabetes type 2 in middle-aged or young people. Now we have an epidemic in all ages. Breast cancer, the dogma was premenopausal breast cancer isn't really an entity except in very rare kind of cases where the family history was just so overwhelming or they had some odd exposure. Breast cancer was a disease of postmenopausal women. Now breast cancer is a disease of all women, all adult women.
Right.
Autism, in order to see a patient with autism, we were taken by bus to the state-run mental facility and worked with autistic children for 2 days in our psychiatric rotation.
Yeah.
It was so rare, there was no place to see it. They didn't come to the clinic.
Yeah.
So this is how rapidly our health has changed. This is alarming, and this is, this can serve as a wake-up call for us all that we have to undergo radical transformation as a society. And that transformation has to come in our food and food supply, in the way we treat our environment and our environmental toxin load, and in the way we treat each other and how much stress we're under, and our consciousness, and whether that consciousness can include compassion, things like compassion and connection and joy and love.
Yes, I agree, and I think you are articulating the elements of danger as well as the avenues for improvement. Let's have a peaceful conversation about fluoride. It's such a hot button issue. It's not maybe at the top of the debate cycle, but it seems to bring out some strong opinions. How do we begin to have a real conversation about fluoride when we look at certain scientific studies show, a decrease in cavities, and others show an increase in cavities from fluoride, and some seem to have a lot of power to the study, and some seem to have problems with the studies, and then we hear that fluoride is a neurotoxin and is never supposed to be swallowed. And how do we have a conversation about fluoride? How do we start that conversation?
Well, I love that question. Fluoride is an incredibly polarized issue, as you know.
Yeah.
And really, I think the more polarized an issue is, the more opportunity for complete transformation by dealing with that issue, by addressing it as a society. When I first started looking into fluoride, as I mentioned previously, it was just another kind of awakening because, fluoride is a neurotoxin. And fluoride is an endocrine disruptor. It particularly affects our thyroid gland, but also probably our glucose regulation. And so I looked at all the science. I spent days, hours, because I didn't have clients at that point. And I just wanted to do this work. So I said, I'll be your consultant. And I literally spent, in the end, probably a year looking at fluoride and delving into the science and connecting with people all over the country who know a lot about fluoride, a lot more than I knew and will probably ever know. These are PhD scientists. And so in the end, it became clear two things became clear. Fluoride is a neurotoxin and an endocrine disruptor. Drinking fluoride makes absolutely no sense from a health perspective. And the other thing that became clear was it's a very polarized issue. And I got involved with Jeremy Seifert, who's the director of GMO OMG, a movie on GMOs that received international recognition and is very, very famous now. He happens to live in Asheville. We met through mutual friends, and he was interested in fluoride, I was. And so we ended up doing this movie together on fluoride. He did the movie. I was just the consultant. But part of what doing this movie entailed for Jeremy and I working together was, how do you transcend such a polarized issue?
Yeah.
Because really, neither of us felt like, oh my God, fluoride's so horrible, or oh my gosh, it's wonderful, but we just kind of felt like, how do you just kind of get the truth out there and move society forward? Because really society always moves forward on everything. We have to rethink and rethink and rethink based on new knowledge that we have and new perceptions and new consciousness.
Yeah.
So how do we tell the fluoride story without just being another polarizing entity? And so we made this movie called Our Daily Dose. Like I said, Jeremy made it. I was just the consultant, but I was very involved with the messaging in the movie and the writing of it and the science. And in the end, we came to see fluoride as an incredibly valuable issue for society to grapple with, because an issue that is so entrenched in society to the point that people get furious when they are faced with maybe taking it out of the water. I think that tells you that it's an issue that needs to be looked at, because why do we really care so much about preventing a couple of cavities? Why do we care enough to put something in all of our public water supply? We don't really care about obesity or diabetes, we don't care. There are lots of health diseases that we don't care. We care, but, our government doesn't care that much about them.
Yeah, right.
So why do we care
there's
about
bigger
cavities?
Problems than a couple cavities.
Exactly.
And yet there's toothbrushing programs that they could implement.
Yes, or diet related, like, the real problem with cavities is eating sugar and refined carbohydrates.
Yeah.
So it really came back to fluoride and tooth decay is a very representative health issue in that it's a minor illness, but it is indicative of bad diet and environmental toxin exposure, primarily bad diet. Toxin exposure just in that it makes us less healthy generally. So if we cleaned up our diet, people who eat really good diets don't get tooth decay, but people who eat processed foods and sugar and refined carbohydrates and no fruits and vegetables, they do get tooth decay. So tooth decay is a disease, is another chronic illness. It's yet another chronic illness that we have an epidemic around right now that is caused by our diet and our lifestyle. So I think that is the message. It's not about fluoride preventing cavities or water fluoridation is a way to prevent cavities for the poor. It's about tooth decay is yet another chronic illness that we need to deal with by looking at the underlying cause of that illness. And if we do that, that will help us all, because the underlying problem is diet, and then all of us will be at less risk for heart disease and obesity and diabetes if we change our diet, and society gives us better food, subsidizes better foods. So, but I just want to talk a minute about fluoride. So fluoride, the CDC and the ADA, the American Dental Association, tell us that water fluoridation reduces tooth decay by 25% at best. That's probably the best number. It's somewhere between 15 and 25%, but we'll say 25%. So that's about one cavity per person in a lifetime. So that's the benefit. But if we look at the risk, so in medicine, we look at risk-benefit ratios, right?
Right.
So the benefit is reducing cavities by about one per person. The risk of putting fluoride in our water is that we are giving all of us to drink through the public water system every day a dose of a neurotoxin. We know fluoride is a developmental neurotoxin. We've known that for many years. The EPA in 2010 did put fluoride on its list of developmental neurotoxin. There are a couple of scientists at Harvard, the Harvard School of Public Health, who are very interested in fluoride and perfluorochemicals and lead and mercury, but they looked at fluoride in the last few years and put it on their list of one of 12 toxins that are known to be, there's enough scientific evidence to tell us that they are developmental neurotoxins. And a developmental neurotoxin is a chemical that has the potential to harm a child's developing brain.
Yeah.
So from the time of conception to the time of 25, our brains are developing, and it is very important that we protect our brains from neurotoxins because it's a very delicate process.
Yeah.
And it's very susceptible to toxic injury, whether it's mercury, lead, fluoride, flame retardants. So right now we have 1 in 6 children who have neurodevelopmental brain disease. It makes absolutely no sense from a medical standpoint to add a known developmental neurotoxin to our public water that our children and adults drink every day.
Yeah, so this is just so much bigger than cavities.
Exactly.
This is about our total health.
Yes, it's a representative issue.
Yeah.
And that is why it's so polarized, because it is a representative issue. It's an issue that speaks to every level of what we're grappling with right now in society. From food to entrenched dogma to money in politics. People make a lot of money off selling fluoride to the government. The perfluorochemical industry is huge. So it speaks to a lot of facets of society where we're all pushing back to maintain our humanity. I just want to say one more thing about fluoride. It's important to remember that when you put fluoride in the public water of about 70% of the public water systems in the country, then when you or your children drink bottled drinks or canned soups or make soups at home, all of that has fluoride in it if it was made with fluoridated water, and chances are it was. So you don't just get a little fluoride from your tap every day.
Yeah.
You get it from any kind of processed water you drink, that you buy, like I said, bottled drinks, soups, beer, all has fluoride. So we have no idea how much fluoride we're each getting each day. A lot of people have looked at that, including a lot of governmental studies. We know that pregnant women and infants are getting massively overdosed with fluoride because they drink more liquid per body weight than adults do. So children really are at the most risk to get overdosed with fluoride. And that's saying there even is a safe dose of a neurotoxin. For my children, I would say I would never want you drinking a neurotoxin at any dose.
Yeah.
We get exposed to plenty out in the world, whether it's arsenic, lead, mercury, flame retardants. Why add another one knowingly? That's an easy one to avoid. You don't drink your tap water and you demand that your government take fluoride out of your water. Fluoride is also an endocrine disruptor. In the 1950s, fluoride was used as a medication to suppress thyroid function. We know that fluoride suppresses thyroid function. Right now, we have 1 in 8 women in our country with thyroid disease.
Yeah.
Again, it makes no sense to be drinking a chemical every day that is known to suppress thyroid function when we're battling this epidemic of compromised thyroid hormone function every day. Health is one issue around which we can all connect. It's such a powerful issue because we all care about our health. We've got to think about this issue from a health standpoint, and the risk-benefit ratio is completely backwards. Yeah. And tooth decay is an important issue in our society because it's indicative of bigger health issues, and it's important by itself.
Yeah. So how do we begin to have a peaceful conversation about GMOs when Monsanto is suing independent farmers and
yes,
for picking up strains of their seeds that blow into their fields? It's such a huge, pervasive issue, these GMOs, that how do we begin to have a peaceful conversation about it and yet make our food supply healthier and safer?
Well, that's a great question. I had the great fortune to work with Jeremy Seifert. I loved hearing Jeremy talk about it because he comes at it from what it means to be human and what seeds mean, what it means to have seeds and access to seeds to feed us, because Monsanto has a monopoly on seeds or is working toward that, and he comes from it from an environmental perspective of keeping the soil vibrant and alive, keeping pollinators alive, so that we can have a healthy interaction with our natural world. That's the only way we're going to be able to go forward as a people, is having that healthy relationship. And then, of course, I come at GMOs more from a health standpoint, and I do think health can connect us all around any issue, because we all want to get at the truth of what these, whether it's GMOs or fluorides or any chemical or any kind of diet, what that means for our health, because we're in a fight for our health right now.
Yeah.
So it behooves us all to get accurate information about things like GMOs, fluorides, etc. And so when it comes to GMOs from a health standpoint, the GMOs on the market right now, more than 95% of them have been either genetically modified to be a pesticide themselves. So every cell, every leaf, every vegetable on that plant that we eat is a pesticide. That's one class of GMOs. And then the other is it has been genetically modified to resist glyphosate. So those over 95% of the GMOs on the market, really even a little higher than almost 100%, but not quite, on the market have been manipulated to do one of those two things.
Okay.
That's really important to understand, because over 90% of the corn, over 90% of the soybeans, the sugar and the canola and the cotton in our country are GMO. Over 90%. That is a huge amount. And those things, as you know, especially corn and soybeans and sugar, are in our food supply. They're pervasive in our food supply.
Right.
So what that does is introduce chemicals at unprecedented amounts into our food supply. It's really important to understand that when we eat GMOs, we are eating a huge amount of chemicals.
Yeah, just sounds horrible. I mean, and it's out there. This is what is out there that we're facing. So, I mean, it's not too late though, right? I mean,
oh, absolutely not. It's never too late. In the last 5 years, the amount of understanding and enlightened thinking around such polarized issues as these on many, with regards to many issues, the amount of change in terms of how people think has just been tremendous. Mm-hmm. People are waking up and understanding what we need to value and what we need to get rid of mm-hmm. in order to keep our humanity. Mm-hmm. And people in all fields, filmmakers, health providers, businesses, it goes on and on. Every day I hear more fields that are, awakening to really embracing what we need to be human and fighting back against what is killing our humanity. Yeah. So, it'll definitely, things are changing fast.
Yeah. Well, I like hearing that hope. I mean, I feel that and believe it, but we do have some, we've got some huge challenges that we have to address, that we have to, face and do our small part, each of us, every day.
And what the first thing we can do is start with ourselves. Exactly.
Yeah.
Make good choices in the grocery store. That sends a message loud and clear to what kind of food we want to put in our bodies. Yeah, and that we're willing to put in our bodies.
So you do consulting for businesses about food.
I do.
Okay, right. Can you tell us a little bit about that? Like what's
Sure.
it's like? Yeah.
Well, it's a lot of fun, for one thing. I feel very grateful for my job. I began working with some attorneys in town who, and regionally, who are trying to push back against the perfluorochemical industry. PFOA is a big topic right now, and people have probably heard of it. It's in Hoosick, New York, and the big DuPont case in Parkersburg, West Virginia. But basically, PFOA is the chemical that's used to make Teflon, Gore-Tex, water-resistant treatments, stain-resistant treatments. And for years, it was made in millions of tons, in a huge amount, and by DuPont and 3M and some other companies. But it doesn't biodegrade in the environment, so it has contaminated a lot land and water supplies and rivers around factories all over the country. And because it doesn't biodegrade, it gets in things like city water systems and then is pumped out to lots of residents, or it gets in wells for miles and miles, or rivers and kills the fish. So it's a huge topic right now. And it's another, it's not quite as polarized, interestingly, but it is another example of the chemical industry, tainting the environment with absolutely no regard to health, because for years they knew how toxic PFOA was, and they knew that it didn't biodegrade in the soil and the water and in the environment. But we kept on pumping it out and making these products. So now about 99% of us in the whole world have PFOA in our blood. 100% of every animal tested has PFOA. So we've covered the world in these chemicals that don't biodegrade. And the same physician who I mentioned has done research on fluoride at Harvard, Philippe Grandjean is his name. He does the research, or a lot of it, on the PFCs or PFOA. And he recently found that even tiny amounts of PFOA in children's blood decrease their ability to respond to vaccines. So it decreased their antibody response. So it's an immunosuppressant. It also is a carcinogen. So things like this are very important to understand, that we are, contaminating our environment in ways that are deadly. Not just that they kill us on the spot, but they're zapping our health. They're sucking our vitality and our humanity. So I got involved doing that, helping attorneys understand the health impacts and what the science shows, what the science tells us that the effects of these chemicals are on health. So I love that part of my job. I can help attorneys who are trying to really push back against big companies who are polluting, contaminating.
Yeah.
And then the final aspect of my job is I do work with businesses. I work with Green Sage initially, helping them kind of write their pure food manifesto and really get their food to a point that is very pure. It's hard to get pure restaurant food. It's easy to cook pure food at home. It's hard to go out and get a chemical-free, high-nutrient meal. So I work with Green Sage. They're very committed to that, to providing clean, pure, conscious, and sustainable food.
Yeah.
And then from that, I just a few months ago this year started working with Earth Fair, and I love that job. I help Earth Fair use health as a target for their growth. Earth Fair is incredibly committed to health, the health of society, and the health of their customers and the health of society. And they're very interested in using, health as kind of a target for how their business is going to grow, to carry better products, cleaner products, more sustainable products, healthier products. And so I help them, they're very knowledgeable themselves, but I help them kind of provide science to back up what they do, or help them vet products, vet ingredients, understand GMO fed meat, which, they do not carry. That's industrial meat. But so just help them understand the food trends, the health food trends. I write their blog. I write articles for them. I help them with their messaging, their health related messaging. And I find that I'm so grateful for that job, because it's just kind of funny, as a physician, you really have so little voice in terms of food or environmental toxins or health. There's just no time for it or space for it in the medical system. But once I stepped out of that traditional medical system and found businesses, partnering with big entities in society like businesses is just incredibly powerful, because they have a huge voice in society. And if we have businesses like Earth Fair doing the right thing, and filmmakers like Jeremy kind of waking us up and giving us good information, we're just incredibly lucky that I'm so grateful for entities like that in society. So anything I can do to help them, I love to do.
Yeah. Well, the last thing I'd ask about is you mentioned consciousness as a practice of how we can live with a cleaner state of consciousness, live ethically, perhaps. Any comments that you'd like to make about that you've experienced in your own life or that you've seen or heard?
Well, the journey of transforming consciousness in order to be more healthy is one I've just started on in the last couple of years. So I'm very new to that journey. So I certainly don't feel like an expert. I've had a lot of incredible teachers who I do think are experts and have thought about this their whole life. But what I would say is this: there's no question that our consciousness as individuals and our collective consciousness as a society profoundly influences our health and our future.
Yeah.
Any step that we can make towards a higher consciousness helps ourselves and helps society. And the problem is there are just so many diversions, and it's so unclear what those steps are. Mm-hmm. And what teachers in this field, talk about, and what I respect very much, and what I try to remember every day is the most important thing to guide our consciousness to a pure place, or a more pure place, and a healthier place, is what we already know in our heart. And it's kind of what we talked about previously. It's what we know about what it means to be human. Mm-hmm. And if we can get in touch with that, then it does transform our consciousness to a higher level. And I think the only way we can keep on keeping on and keep trying to get in touch with that is by bringing it back to what do we need to be human at our very highest level, to manifest the beauty of being human, which is laughter and joy and compassion and human connectedness and bravery and all those wonderful traits that really only humans have. Courage. What do we need to manifest those traits at their highest level? And what we need is safety, security, which comes from human connection and loving each other. Mm-hmm. We need healthy, substantive food. And we need a clean environment. And I think if we just every day bring it back to those three things in our daily choices, and in how we fight in society, then we all will work toward a higher collective consciousness that brings us more toward health and humanity.
Well put. Yeah, thank you for all of these observations. There's a lot of information we've covered here, which is very interesting, and I'm going to have to continue researching these topics, and I definitely want to see these films. And thank you so much. Anything else that you wanted to talk about?
I just want to say thank you.
Yeah,
it's been a pleasure getting to know you, and I know you're on your own alternative medical path, which I very much respect. And I think that's what it's all about, is being inspired by others. So many people have inspired me over the last 5 to 10 years, and so many teachers and also just everyday people who just keep fighting and keep challenging life struggles and stepping up to the plate. And I guess I'm just really grateful for all those people in my life, including you.
Well, thank you. And thank you for being in my life and having this opportunity for this conversation.
You're so welcome.
Yeah. All right, great. Well, thanks, Angela. I appreciate it.
Thank you, Dan.
All right.
All right, well, that's it. That's my conversation with Dr. Angela Hind. Thank you so much for what you shared, Angela. This has been such an experience getting to meet all these folks through the Anecdotal Evidence podcast. I hope you've enjoyed these conversations. I Hope to have a couple more for you before the end of the year, before we wrap things up here in 2016. If you have any questions, please send me an email at anecdotalevidence@danieljohnsonmd.com. And I'm going to be sharing a couple more episodes with you, I hope, and wrapping up what I've learned from this experience. So tune in for that. And until then, thanks for tuning in this week. This is Daniel Johnson, MD. Take care.